Hi, I'm here with our new hire. I'm so excited to introduce her to everybody. Ariel Katz. We are so lucky that she has joined us. And really today we just want to give her some time to speak about her specialty, her expertise, a little bit about who would be a good fit for her. So Ariel, if you wouldn't mind, just take it away and give us a little introduction about you.
Sure. Hi. I'm so excited to be here. So I got my degree in mental health and wellness counseling from NYU in 2022. And a lot of my focus in graduate school was on learning the mental health side of chronic illness and learning different treatment modalities that are helpful in navigating life with chronic illness. I always knew, like, from a very young age that I wanted to be in a helping profession, but it was actually my own experiences with chronic illness that brought me into this specific space. So I started to experience chronic illness when I was in college, and it had a really big impact on my mental health. And I was really surprised at how challenging it was to find compassionate and understanding and empathetic care from the mental health side. And I was fortunate enough to find a wonderful therapist who was able to help me cope with the challenges related to uncertainty and anxiety and shame and fear and all the things that come along with chronic illness. And she also taught me how I could live this meaningful life alongside chronic illness. So that ultimately brought me to realize that I wanted to be a therapist as well and help others with chronic illness. And I also have talked to a lot of people who live with chronic conditions and kept on hearing how much there was this need for therapists who were understanding, compassionate, and can use this holistic approach. So it brought me to the space of wanting to help people who were dealing with similar challenges.
And I mean, everything that you shared is so impactful, especially the difference of you having this personal journey and being able to be both a person in the room and a clinician is so impactful. And like you said, it's hard to find kind of this niche understanding where there is a lot of empathy and nuanced understanding of the challenges that are a little unique dealing with chronic illness. For us, I know, we use Third Wave CBT at our practice, and people might be thinking, I've never heard of that. Maybe you could share a little bit about Third Wave CBT and how you feel you use it and how it shows up in your work.
Of course. So Third Wave CBT stems from traditional CBT, but with Third Wave CBT, the focus is on our relationship to our thoughts, feelings, and sensations. And it really focuses on the ways in which we can live a meaningful life despite the presence of some suffering or some pain. It uses a bunch of different techniques. So we use acceptance, mindfulness, self-compassion. We clarify values and learn to live based on our own values. And we use a lot of nervous system regulation techniques and somatic techniques, along with distress tolerance and emotional regulation, again, in order to reduce that suffering, even in the presence of pain. And with Third Wave CBT, two of the main approaches are acceptance and commitment therapy and dialectical behavioral therapy. So with acceptance and commitment therapy, we learn to notice and accept our internal sensations, and we can do so without judgment, while also learning how to live a life that is very aligned with our values or what matters most to us. And with DBT, or dialectic behavioral therapy, we look at more of the practical skills. What skills can we be using to help to regulate challenging or overwhelming emotions, or solve interpersonal problems, or maybe cope with distressing circumstances? So I find these approaches with chronic illness to be very effective, and ultimately they meet people where they're at. And with chronic illness, a lot of times people have unfortunately experienced medical trauma, or they've experienced invalidation. So it's really important that the therapeutic approaches are ultimately trauma-informed, compassionate, collaborative, and very flexible, and prioritize a sense of creating safety and also validating a person's lived experiences. So I find I use these tools and techniques in order to create this space of safety. And also it helps because with chronic illness, a lot of times the symptoms may not go away, but it provides this opportunity to be able to reduce suffering and to feel safer in the present moment, even when these really challenging symptoms or emotional symptoms may be showing up. And I love how it really incorporates this sense of somatic work and creating the sense of safety within the body through nervous system regulation in order to broaden the nervous system's window of tolerance. I also use the approach very flexibly because chronic illness is so unpredictable. So what I do is I'll create this very rich and personalized toolbox with each of my clients, and we will select what feels accessible at a given moment in time, whether it's during an intense flare-up or feeling overwhelmed or maybe feeling ready to make a change.
You described that perfectly. I mean, just so encapsulates the flexibility within our approach that this is not just a one size fits all. And you are really, I think, describing it in a way that feels very tangible for people to kind of understand that also acceptance doesn't mean that we like what has happened, right? And
Yeah.
I think that can be confusing when people hear acceptance and commitment therapy, yet this is a chronic condition. And you have mentioned that several times, like living within your values and a meaningful life is something that, yes, those reframes and creating helpful thoughts is so important. We also need that somatic piece and the um, more existential at times piece, right? That the acceptance and commitment therapy can give. And for you, I mean, you described why this is so helpful for chronic illness. What are the populations within that community that, people would be really lucky to work with you?
So, of course, I love working with individuals who are navigating their chronic illness journey, especially people who are living with endometriosis or chronic pelvic pain or related conditions. I get that a lot of these conditions are often misunderstood. So, I really value creating this therapeutic space that is validating and understanding and can bring up some self compassion amidst conditions that promote a lot of shame.
Absolutely. And you're touching too on the misunderstanding, the medical gaslighting that maybe they've
Yeah.
experienced oftentimes. And you're able to say, I understand that this is not in your head, that this is misunderstood, and we can give you support for the emotional journey that you're on too. Um, that that's so important. And our view is we value a multidisciplinary approach. And why, just for, to explain for your point of view, why do you enjoy multidisciplinary care for chronic illness clients specifically?
So chronic illness impacts every area of life, and there is such a deep connection between the mind and the body. So when we look at collaborative and integrative care, we're able to treat the mind, treat the body, and the ways in which they're interconnected. And when clients are open to me working with other providers, we can create this very integrated and holistic treatment plan that really looks at the entire person. I also really value being able to advocate for my clients and make sure that across all different fields, the care is as trauma informed as possible. I also find it's helpful for me as a clinician to be able to understand what's going on medically, because that
Yeah.
allows me to tailor the interventions based on a person's current needs and be really grounded in where they're at. It also takes a lot of the burden off of the clients to have to bridge this gap in explaining what's going on medically, and it allows the therapy space to be focused less on the medical content and focused more on what's needed in a given moment in a person's healing.
hmm Absolutely. One thing that I find, like just one example of that where it can be so helpful is if we can reach out to a PT and say, hey, this is some of the grounding and down regulation stuff we're doing. Do you have breathing techniques? A lot of times pelvic PTs are already doing, diaphragmatic breathing. Like, how can we supplement that? And like you said, take off the mental load. What we don't add more on our client's place where we're trying to, pull back that burden. And yeah, those working relationships are so helpful for the whole team. So that I'm glad to hear you speak of why it's so helpful. Thank you so much for taking time to introduce yourself to everyone.
Of course.
And I am thrilled that you're here. If you could share how people can reach you to schedule a phone consultation, and what is your availability like throughout the week?
Yes. So to reach me to schedule a consultation, you can go onto our website, womencbt.com, and fill out the contact form. My hours are currently Monday through Thursday, 10 a.m. through 6 p.m., and I am working virtually.
Amazing. Gives so much more flexibility with that telehealth option. Thank you so much for being here, and we can't wait to meet you. If you're interested in working with Ariel, go ahead and reach out. We're looking forward to expanding together.